heart and neck vessels today, okay?
Okay.
Alright, well I want to verify your name and your date of birth. And I've got that your name is John Doe, date of birth 4/26/1990. Is that correct?
That's correct.
Okay. Well, I've cleaned and sanitized my hands. But before I begin, I just want to ask you a couple of questions that pertain to the assessment today. Do you have any history of a heart condition or anything like that? Anything wrong with your heart?
No, ma'am.
Okay. Any history of any chest pain?
No.
Okay. All right. Well, I want to begin by inspecting your carotid artery. So turn your head that way for me. Sitting upright, I do not note any pulsations of the carotid. Turn your head the other way. Okay, but I want you to lie back at about a 45-degree angle for me.
Okay.
Okay, and a little bit more right there. And just turn your head that way. Okay, and back this way. Okay, and at a 45-degree angle, I do not note any visible pulsations of the carotid artery at either. So next, I want to auscultate your carotid. So I'm going to do this with the diaphragm and the bell of my stethoscope. So if you will just kind of lay your head back, relax back for me. And I don't note any bruise in your right or left carotid artery, okay? And next, I want to palpate your carotid. So lay your head back, please, and relax. Okay. Now, I would say that your carotid pulse is 2+ and without thrills, okay?
Okay.
All right, next I want to inspect your precordium, which is the area on your chest where your heart's located.
Okay.
As I'm looking at your precordium, I don't note any apical impulses, no heaves or lifts are visible over the precordium, but I do want to palpate it really quickly, okay?
Okay.
So just lay back and relax. I'm using 2 fingers, and I'm starting at your aortic area. Then I'm moving to your pulmonic area, and then down to Erb's point, and then tricuspid area, and then the mitral area, which is the apex, where the apex of the heart's located. Okay, and as I'm palpating, I don't feel any abnormal vibrations or pulsations at the apex, the left sternal border, or the base of the heart, okay?
Okay.
All right. Now, I've located where your apical impulse is. So I did that with 2 fingers. And then I'm going to place the palm of my hand on that area, and I'm going to palpate this area for 1 minute, counting your heart rate. So I would say that your heart rate, it is 68 beats per minute and regular. Your apical impulse is 1 centimeter in diameter. The amplitude is small and brief duration, which is all normal, okay?
Okay.
All right, next I want to auscultate your heart sounds. So just relax back in the chair for me.
Okay.
And first I'm going to do this with the diaphragm and my stethoscope. And I'm starting at the aortic area, which is at the second intercostal space on your right sternal border. Okay, I do hear audible S1, S2. I don't know an S3 or S4. And your S2 is louder than your S1. And then I'm moving over to your pulmonic area, which is at your second intercostal space on the left sternal border. Your S1, S2 is audible. I don't hear an S3 or S4. And I would say that your S2 is louder. Then I'm moving down to Erb's Point. It's at your third intercostal space on your left sternal border. Your S1, S2 is audible. I don't hear S3 or S4. And I would say that your S1, S2, the loudness is equal. One's not louder than the other. Then I'm moving down to your tricuspid area. This is at your fourth intercostal space on your lower left sternal border. S1, S2 is audible and present. I don't hear S3, S4. And I would say that your S1 is louder than your S2 because we are auscultating at the apex of the heart. And then I'm moving down to your mitral area, which is at your fifth intercostal space. It's in your midclavicular line. Your S1, S2 is audible. Your S1 is louder. I don't auscultate at S3 or S4. So that's normal. Alright, now I'm going to go back with my bell and my stethoscope and see if I hear any softer sounds like murmurs or any other abnormal sounds.
Okay.
So I'm starting at your aortic area. Moving over to your pulmonic area. Down to Erb's Point. To your tricuspid area. And then to your mitral area. Okay, and I don't auscultate any murmurs or any abnormal sounds like blowing or swishing, okay?
Okay.
Alright, next I want you to turn over on your left side for me.
Okay.
And I just want to listen again to those same places with the bell of my stethoscope.
Okay.
To see if I can hear a murmur or any abnormal sounds. It's easier to hear them in this position. Turn over a little bit more. There you go, right there. Okay. So same landmarks. I'm listening first at your aortic area. And then to your pulmonic. Down to Erb's Point. Tricuspid. And mitral. Okay, and I don't hear any murmurs or any abnormal sounds such as the swishing and blowing.
Okay.
So next I want you to sit up in the chair and kind of lean a little forward for me. Kind of scoot back in the chair a little bit, but still lean forward. There you go. Okay. Alright, and I'm going to listen with the diaphragm and the bell in the same landmarks once again to see if I hear any abnormal sounds. I'm at the aortic area at the second intercostal space. I'm at the pulmonic area. And down to Erb's Point. Tricuspid. And mitral. Okay, good. And I'm going to go back with the bell and listen one more time. The aortic. Pulmonic area. Erb's Point. Tricuspid area. mitral area. Good. So same thing. I do auscultate at S1, S2 in all those areas. The S2 is louder at the base of your heart, which is the top area, and then the S1 is louder at the apex of your heart, which is normal. And I don't auscultate any murmurs and no any abnormal sounds such as blowing and swishing. Okay?
Okay.
All right. Well, that concludes my assessment of your heart and neck vessels. Do you have any questions?
No, ma'am.
Thank you.
Thank you.